Well, for all the latest COVID-19 developments, I'm joined by Dr. Georges Benjamin. He's Executive Director of the American Public Health Association. Thanks for joining us. We certainly appreciate it. It seems we never run out of topics to talk about it when it comes to COVID. Can you give me the latest on hospitalizations and where does the virus stand globally?
Well, we're beginning to see a great diminution of this virus all around the world. There's still pockets, but we're beginning to see this Omicron variant decrease. We're not out of the woods yet, but I think we're all hoping that we have a prosperous future, at least a lull long enough for us to kind of begin to normalize our society.
Yeah, it's great. I'd love the almost out of the woods. I think everybody wants to hear that. We are weary of COVID. We're weary of social distancing, sick of wearing masks. But is there perhaps a disconnect right now between state and federal governments on mask mandates, and any chance we're getting too comfortable and perhaps letting our guard down?
Hey, I'm a little worried about us getting too comfortable. And so what I've been certainly recommending when I'm asked is that we just take this one step at a time. Um, you know, some of the mandates can go, but we do still need to encourage people to mask when it's appropriate. Certainly when you're around someone that you don't know whether or not they're fully vaccinated or you're in large crowds, wearing a mask is still very important. But in the United States, we still don't have an adequate number of people vaccinated. So really, vaccination still needs to be the emphasis for this addressing this outbreak right now.
Yeah, and you certainly have those people that continue to push back. Now, I've been fully boosted as long as possible, and if there's a fourth vaccine, I'm first in line to get it. Now, Sweden is the latest nation to urge the elderly, people 80 and above, to receive a fourth vaccine. Do you think that could be in the future for a lot of nations?
We're going to probably have some periodic vaccination program, just like we have with influenza. Maybe it's once a year. I hope it's not every 6 months. I just think that's going to be too burdensome. But whatever it turns out to be, people who are older, who have underlying medical conditions or have immunologic diseases, we know that they're not as fully protected even when fully vaccinated. So they're certainly going to be first in line.
Yeah, I want to talk about the younger, because there's a strong debate about toddlers and vaccinations for kids under the age of 5. I'd like to get your thoughts on that. Is it necessary? And what about the argument that kids that are so young could be largely asymptomatic?
Many of those kids are asymptomatic and they don't seem to get as sick, except that on a volume basis, when you have a disease like this running through the community, there's going to be tragedies. And if you can do it to prevent these kinds of tragedies, and we know the vaccination will do that. Look, in the first 6 to 8 months of life, children are protected by their maternal antibodies after they're born. But after that, their immunology begins to change, and they get to be exposed to all kinds of viruses and other infectious diseases, and they build protections. But this disease is just so infectious and so lethal when people really get sick that we need to protect the kids as well.
Yeah, great points there. This may be a bit unfair, but I'm curious about what happened in Hong Kong. Why the rash of people getting COVID kind of so late in the game? They did such a good job of really keeping it out.
Yeah, Omicron. It just turns out it's just a very different, strain of the virus. It's just much more infectious. And even the kinds of protections that a place like Hong Kong had, and look, even in the United States, in the places in the United States that did very well in terms of getting people vaccinated, we had just these infections that just got through. But the good news is it is more infectious, but not very lethal.
Exactly. Everybody wants to know, what is this summer going to be like? Family get-togethers, people want to go back to concerts, live music, public transportation. Could it be mask-free?
Oh, I think that we're going to be able to reduce our utilization of masks. But, at least in the United States, we're going to become probably a mask-wearing society much more than we were before this pandemic. Other parts of the world wear masks frequently, particularly during colds and flu season. And I think we're going to see that in the future here in the United States as well.
One big hot button issue, schools and mask mandates. You talked about it earlier, about people pushing back, not wanting to get the vaccines. Does it concern you when you see things like this break out, especially in local areas, communities where people really are getting angry about this, going face to face?
Yeah, I think people need to take a deep breath and cool it. These vaccines are safe and effective, and we ought to normalize this and get the shot. And I just encourage people, putting my doctor hat on, that this is like any other medication. It's been studied. Millions and millions of people have had it, and it, quite frankly, has saved so many lives that I can't imagine why people don't want to get vaccinated.
Yeah, you got to watch out for the people. I've done my own research. Well, Dr. Georges Benjamin, thank you very much. We appreciate your time. Executive Director, American Public Health Association.